Okay, so chapter 29 is about disorders of the lower urinary tract. So the lower urinary tract is responsible for the transport and elimination of urine, and its structures include the ureters, urinary bladder, and the urethra, as well as any associated urinary sphincters. Now we know the function of the ureters is to collect urine from the renal pelvis and transport that towards the urinary bladder. And the urinary bladder stores and expels urine through the urethra, and the urethra is basically just a tube that helps transport urine from the body. Now there are some associated urinary sphincters as well, and these actually aid in the prevention of urination when unnecessary. Now the word micturition is voiding, and it's both a reflex and voluntary mechanisms. And the reflex is mediated by the micturition center in the pons. There are different disorders of voiding or urinating. So, we have dysfunction of voiding. There's congenital neoplastic disorders, ones that are due to infective disorders, inflammation, and obstructions of the lower urinary tract. So the first one we're going to talk about here is voiding dysfunction. Now, voiding dysfunction, basically just means improper urination. So urination when unnecessary or undesired, and it could be secondary to other disorders of the lower urinary tract. But basically, they're often going to be from pathologies that affect the central peripheral nervous system or the autonomic nervous system, since urination requires a little bit of all three, since it is both a reflex and a voluntary system. But there are just a wide variety of factors that affect the control of micturition, things like medication and access to toileting facilities. Now, incontinence is just the report of any involuntary urine loss, and it's not normal under any circumstance, nor is it a normal part of aging. We'll talk about aging in later chapters, but there actually is no normal part of aging. There's things that are common, but aging is just sort of what happens to your body as a consequence of genetic and lifestyle factors. Enuresis is intermittent incontinence while asleep, and it's inappropriate wetting of clothing or bedding, and it typically refers to incontinence in children, particularly at night, and this could be associated with anxiety disorders, and we'll come back to that later when we talk about the psychological disorders in a future chapter. Now, there are congenital disorders of the lower urinary tract as well, like vesiculorenal reflux is basically where you have reflux of urine from the urinary bladder to the ureter and renal pelvis, and this is due to the incompetence of a valvular mechanism at the ureter bladder junction. Typically there are some one-way valves that prevent the backflow or reflux of urine from the bladder back in the ureters, but if these valves fail, then we get reflux, and this vesiculorenal reflux can put someone at risk of urinary tract infections. Now, obstruction of the uretopelvic junction is basically blockage in urinary flow. It can be partial or complete, anywhere from the renal pelvis to the entry point of both ureters, and this can actually lead to like post-renal kidney injury. Now, ureteral ectopy is basically where a single ureter is implanted in an abnormal location, or there might be a duplicate ureter as well. And this can increase the risk of infection and reduce renal function if there's poor outflow, or if the ureter attaches in a place that makes it more at risk for reflux and that kind of stuff, can definitely increase the risk of infection. And ureterocele is a cystic dilation of the distal end of the ureter, which can also put someone at risk for infection because this often makes the valve fail that normally prevents the backflow of urine from the bladder back in the ureter. Now, in terms of neoplastic disorders of the lower urinary tract, we'll talk about bladder cancer here. And bladder cancer is the fourth most common cancer in males, ninth most common in females. The risk increases with age, but some predisposing factors for bladder cancer include things like smoking, as well as exposure to different carcinogens. Most tumors originate from the transitional epithelium, or urothelium, that lines the inside of the urinary bladder and other parts of the urinary tract. And it primarily manifests as a painless sort of hematuria or blood in the urine, where frequency and urgency may be present due to an occlusion of the bladder, so the bladder has a lower capacity to store urine. In terms of inflammation and infection of the lower urinary tract, urethritis is just inflammation of the urethra. Can be caused by infection from the bladder or STD-related external factors. Otherwise, it could also come from like frequent catheterization or even poor hygiene. Now, there are some STDs that are confined to the urethra, and they can cause urethritis. We'll talk about some later. And the infection of other etiologies may ascend to the urinary bladder before symptoms actually present. So, you might have an infection that starts in the urethra, it can spread to the bladder, and then signs and symptoms could present later. But some of the signs and symptoms that will present will be things like pain during urination or dysuria, burning sensation, or even incontinence due to damage to various sphincters. Now, cystitis is the word we use for inflammation of the bladder. It comes from infection, chemical irritants, stones, or trauma. Most cases have an infectious etiology, and they often result from infections of the urethra, which then spread up to the bladder. Some predisposing factors for cystitis include female gender, because females have a shorter urethra. There's less distance bacteria need to travel to get to the urinary bladder. Increasing age also plays a role. Frequent catheterization, diabetes mellitus, other bladder dysfunctions, like if someone has difficulty voiding, poor hygiene, or even urinary stasis. Now, obstructions to the lower urinary tract can occur through things like lower urinary tract urolithiases. And these are basically stones that can form anywhere along the urinary tract. Most often, these obstructions are caused by stones that travel to the ureters, the bladder, or the urethra after they start in the kidney. But they can also originate in the bladder and ureters. Some manifestations are basically going to be with things that result from irritation and obstruction. So you're going to see things like, cystitis, urethritis, and possibly obstruction that, if severe enough, can lead to post-renal kidney injury.